Dr. Carter, those latest statistics that we've had, 246 cases, quite a high number. And anecdotally, most of us seems to know someone who's got COVID at the moment. So are we in the middle of a spike?
So thanks very much for having me on this evening. This isn't unexpected that we're going to see spikes and peaks for the rest of the year in terms of COVID infections. Like many other countries, like the UK, France, we're seeing the BA.5 Omicron variant that is causing this current increase in cases. But what's really reassuring is it's not translating into severe illness. We've got no people on critical care at the moment, and indeed most of the elderly residential services, it's either they have no symptoms or mild symptoms.
Okay, why are the cases so mild in comparison to before? Is the variant milder? Are we less? Is there more resistance because of mass vaccination? Is the virus dying off? I mean, why is it so mild?
It's a combination of factors. Undoubtedly, vaccination has a role to play with that, and we're really seeing the benefits of that in the elderly residential services cases where we've got very high levels of vaccine uptake there. And that is indeed protecting against severe disease. But yes, we're monitoring the variants very closely, and at the moment, the BA.5 variant doesn't appear to be causing significant severe illness.
Now, 30 is obviously quite a high number to be ERS, to have positive cases in ERS. And I know that you said a lot of them are asymptomatic, but are there any plans to sort of vary entry rules, you know, for who can visit or anything like that?
So not at the moment. We're working very closely with ERS colleagues. We've had an outbreak control team meeting, reviewed all their control measures, and by virtue of the fact that it's not resulting in severe illness, we're keeping visiting under review, but no plans to change it at the moment.
Okay, so what's the trigger then? Because, you know, these cases are quite high. A lot of us are becoming ill. Isolation rules, self-isolation rules in the UK are more relaxed than they are over here. It's recommended, whereas here you do have to self-isolate. So can you foresee any changes anywhere?
Not currently. My advice to the government is that we retain this precautionary approach with isolation of positive cases. Clearly, we keep this under review, and I review the number of cases, the number of hospitalisations, the number of deaths. You know, we've sadly had 2 deaths this week, but I'd like to reassure people that COVID wasn't the direct factor of death. It was listed on the death certificate.
What about the review for the rest of the year? What is the forecast at the moment?
So, as I said, we're expecting to see some ripples through the rest of the year. We're waiting to hear what guidance there may be around whether we require another booster in the autumn. So we're just waiting to review the evidence of that. I'll then review that, provide my advice to the GHA about what works for Gibraltar.
And we haven't seen the number of active cases in the statistics. Can you give us an idea of what the whole number is?
No, because we know that there's reduced testing happening across Gibraltar for a whole variety of reasons. So we know that not everybody is testing and reporting illness to us. Thank you very much to those people who do notify us either through the online form or calling the public health team.
So no need to panic and no change in any rules?
Nothing planned at the moment, thank you.